Hi, my name is Ola, and for this assignment, my role is the state veterinarian. So my presentation is going to be on the response of the state veterinarian to the Ebola outbreak in Congo. Just a quick outline. I'm going to start the presentation with just a quick discussion on the case study, which is the Ebola outbreak in Congo. And then I'll talk about the role of the state veterinarian and then some steps to respond to the outbreak, preventative measures, and conclude. Now, the case study is basically the Ebola outbreak in Congo. As we might know by now, the Ebola virus disease is a potentially fatal hemorrhagic disease of humans. It basically causes internal bleeding in infected humans, and it's usually quite fatal. The Ebola virus disease was first described in Congo in 1976, and so far the case fatality rate has ranged from 60 to 70% in the three countries where the disease is most prevalent, which is Sierra Leone, Liberia, and Guinea. The potential sources of the Ebola virus are animals. So the Ebola virus disease is a zoonotic disease. The sources have been identified to be from animals such as fruit bats and non-human primates. The disease is transmitted to humans by direct contact with infected animals or by the body fluids of infected animals or other infected humans. The people that are usually at highest risk are the healthcare workers that are in direct contact with infected patients when they're not wearing the required protective equipment. Also people that are caring for patients at the hospital or at home, and those that have had direct contact with people that have died from the disease as well. Now, the role of the state veterinarian. This quote was by Abel Wade, who's the director of National Veterinary Laboratory in Cameroon. Basically says that around 75% of human diseases originate from animals. And this basically is why it's so important to stop diseases from at the animal level. And it basically highlights the importance of the role of the veterinarian in this case study, in the Ebola outbreak. So typically the role of a veterinarian can be described in the six points here. So the first is the management of zoonotic diseases, which basically will encompass the diagnosis, surveillance, epidemiology, control, prevention, and elimination of the disease. A veterinarian can also play a role in the management of health aspects of laboratory animal facilities and diagnostic laboratories, and also that ties in with biomedical research, which especially with this case study in Ebola, there's a lot of research that needs to be done in order to better understand the virus and the disease, and to eventually hopefully be able to develop like vaccines or treatments that would be able to cure the disease. A veterinarian will also play a role in health education, which I will discuss a little bit later in the presentation, and also in the production and control of biologic products and medical devices, and the veterinarian will also play a role in government and legislative activity, which would involve like working with the policy analyst or policymaker to basically develop policies that will protect the interests of animals and prevent like the transmission of zoonotic disease or future outbreaks. Now, Ebola from a veterinary perspective, just a few more facts on the disease. So the Ebola virus has infected a number of animal species by natural and experimental methods. However, the exact animal species that play a role in the transmission of infection to humans is still being investigated. During outbreaks, research has determined that the Ebola virus is zoonotic, and bats have served as reservoirs and the source of the infection. So bats would typically play an important role in outbreaks. The resistant Ebola virus has also been detected in pigs, and the virus has been seen to be replicated in pigs, and the zoonotic transmission from pigs to human is also being described. The Food and Agricultural Organization of the United Nations has warned the public about the Ebola virus outbreaks being related to consumption of bat meat. And the virus disease outbreak, the Ebola outbreak in humans, have also been associated with infected apes, which are hunted for food. So this basically just shows why the veterinary perspective is important when addressing an outbreak, especially for Ebola, because it's likely that the source of the outbreak is from an animal, from hunting animals or ingesting infected animals, or just basically being in contact with humans, being in contact with the bodily fluids of infected animals. Now, in responding to the outbreak, the first step is detection. It's very important that the disease is detected quite early to prevent further spread of the disease. So detection will involve diagnosis, surveillance, and epidemiology. It's important that the veterinarian will determine all the reservoir animals that are carrying the virus to reduce the rate of transmission. And the use of nuclear-derived techniques can be employed, which has been done in Congo, actually. For example, the polymerase chain reaction, PCR technology, allows for the identification of Ebola virus within a few hours, and it has a high degree of accuracy. So that will be employed as well to test animals and detect which ones are carrying the virus. The risk assessment is usually done by the public health team. Basically, we'd evaluate the scenario and ask questions such as, is the public health impact of the event serious? Is the event unusual or unexpected? Is there a risk that it could spread across international borders? Are there travel or trade implications and things like that? So answering these questions would basically have an impact that influence the plan of action towards responding to the outbreak. Now, in responding, the state veterinarian would basically play the following role here. So it'll be important to set up a quarantine of the pen or the building wherever the animals that are infected are found. So whether it's a farm unit or an entire farm, a quarantine would be set up. It'll be important to designate separate caretakers for the affected animals, ensuring that those workers visiting the affected animals wear protective footwear and clothing so that they prevent contamination with other animals and further transmission. And then it'll be important to check and examine and treat the sick animals as well. So this is basically what the response from the veterinarian's perspective would entail. Now, once all of that is done, it's also very important to educate the public. So health education is an essential part of controlling the outbreak. So just recognizing that the Ebola virus is transmitted through wild animals like bats and monkeys and gorillas, the public should be advised first to avoid direct contact with bats and non-human primate blood, bodily fluids, and raw meat. Meat should be properly cooked before consuming. Pet owners who travel to areas in the epidemics, they may be pet owners in the Congo that are traveling to the areas where the disease is highly prevalent, should be warned that the disease is a zoonotic disease, that Ebola is a zoonotic disease, and dogs could pass the virus on to humans through biting or licking and direct contact with their urine or feces. Pets that are exposed to an infected individual's blood or body fluids have potential risk, and it should be reviewed by a veterinarian as soon as possible so that they can implement quarantine. And also, pet owners that are infected with the disease should be aware that their animal may become infected, and even if they don't show any symptoms, they may be effective in spreading the disease. Now, finally, this scenario basically highlights the importance of One Health. It shows the interconnectedness between animal human and environmental health. And the inseparable nature of the human and animal health demands that the Ebola virus outbreak be approached holistically. So it'll be vital for efficient collaboration between all the parties involved, like the epidemiologist, state medical officer, health educator, policymaker, and such. And like we mentioned earlier, early detection is the first vital step to controlling an outbreak, which the state veterinarian can help with. Outbreaks should be investigated to enable, to basically see what lessons can be learned from the event so that we can enable we can prevent the outbreak from occurring again in the future. Further research into the epidemiology and pathogenesis of the disease is needed in order to improve our understanding of the disease and to develop vaccines and treatments as well. And finally, the gorilla and chimpanzees population in the world is also quite at risk. So there should be collaboration to protect the ape populations in order to make wildlife continuity a priority. Thank you.